Hypertension is one of the leading causes of death worldwide. So chances are you or someone you know could or have already lost someone to complications of hypertension. Our roles as professionals is to educate you, but some of your choices can predispose you or increase your risk of developing hypertension. So keep watching so you learn some of those choices. And if you have medical questions or concern, just leave a comment. Top of those choices is our food choice, especially a diet that is very high in salt and low in potassium. Salt causes your body to retain water, and that will increase your blood volume, ultimately increasing the pressure. Number 2, cholesterol. Your fried foods, your red meat, your butter, baked goods, sweets. All these are foods that have high fat content. And what happens is, over time, they deposit in the walls of the vessels that supply blood to the heart. And that will put a strain on the heart, ultimately increasing the blood pressure. Number 3, alcohol. Alcohol is a major culprit for hypertension. Let me put it plainly so you understand. It increases the hormone in the body called renin that narrows the channels through which blood flows to the heart. And that hormone also regulates the fluid in the body. So imagine this, very narrow channels and a huge volume of water. Obviously, that will cause an increase in pressure. Number 4, a sedentary lifestyle, where there's minimal to no physical activity, leading to weight gain. And obesity is a major risk factor for developing hypertension. So for those of you who work long hours, it's advisable that you take walks during your breaks. And those of you who have to go to the office, sometimes you can take the stairs instead of the lifts. This will not only reduce your chances of developing hypertension, it will also improve your blood circulation. While some of these unhealthy choices increase our risks, some other factors are not within our power to change, like age. Blood pressure tends to increase with age, especially for those over 60. Genetics. If there's a positive family history of hypertension, the likelihood of you getting hypertension is high. Race. Hypertension is commoner among Blacks, so you likely find it within Black Africans or Black Americans than you would in white or Hispanics. Gender. Men are more likely to develop hypertension than women, but over the years, some results have varied. Socioeconomic factors like your job, your income, generally your status in life. All those are things that can increase stressors, ultimately increasing blood pressure. And of course, lastly, comorbidities like diabetes. So for those of you who already have an existing health conditions, one of the complications of diabetes is damage to the blood vessels, and ultimately that will lead to increase in blood pressure.